Welcome back. Did you know that oral cancer kills one person every hour here in the United States?
Now, April is Oral Cancer Awareness Month, and we want to talk about the importance of getting screened every year. Dr. Terry Alani is joining us now to share more. The Texas Tooth Lady, thank you for being here.
Thank you for having me.
Okay, this is a really important conversation to have, you know, the importance of oral health and being screened for oral cancer. Tell us about it.
So absolutely. So as dentists, we really are the gateway. The mouth is the gateway to the rest of the body. We can help diagnose and see areas that are of suspect. We can diagnose sleep apnea. If you have high blood pressure, we refer you to the cardiologist. So oral cancer is another area where, as dentists, we can really help the population. Oral cancer does kill one person every hour in the United States. The reason the mortality rate, if it is not caught early, because it's hard to detect with the naked eye, it's 50%. Oh. But if it's caught early, it's a 90% survival rate. So those are really important statistics. So we have a device in our office, and most dentists will offer, that can really help diagnose. And it has increased fivefold in the population of people under 40 because of the HPV virus, which, as we know, is a sexually transmitted disease. So we recommend the velscope for anyone, oral cancer exams annually for anyone over 17 years old.
And Dr. Alani, you talked during the break, we were talking about the risk factors. Tell us a little bit about that.
Okay, so your risk factors would be anybody that has tobacco, right? And if you notice, a lot of the professional athletes now, especially the baseball players, have gone from chewing tobacco to excessively chewing gum. But gum, if sugar-free gum has xylitol in it, so it can actually help prevent cavities. Another area would be excessive sun exposure, heavy alcohol use, and of course the HPV virus. Those are a lot of the risk factors, and if you have a weakened immune system.
Okay, so let's talk about signs and symptoms maybe, and how you would use this velscope to maybe find the cancer.
So it's, you know, unlike a mammogram, it's really hard to do a self-diagnosis, but if you have a sore in your mouth that hasn't healed for over 2 weeks, you need to get it checked out. Also, if you have ear pain, or if you have difficulty in swallowing, if you have any type of numbness in your face that you cannot understand what is going on, any of those things can be a sign of oral cancer, possibly. And so this is the velscope, and what this is this is a handheld device. And it emits, I'm going to go ahead and turn it on, just don't look at the light.
Oh, okay.
It emits a blue light. And this blue light highlights suspect areas. It's a 2-minute exam. It's painless. And what we see is any healthy areas are going to be like a green, emit green, but unhealthy areas are going to appear dark. And when we see those, we can either biopsy or we can send the patient to the appropriate person, head and neck doctor or surgeon, to actually, you know, do the biopsy and see if there's something that needs to be addressed.
So at what age can people start getting screened?
So let me get this back in. So we recommend anyone over 17 years old, and it's because of the prevalence of the HPV virus. And most of the oral cancers appear on the tongue and the lip. And not always is it something that you would notice. In my career, I've been practicing for a long time. I've diagnosed 5 patients with oral cancer, have totally saved their lives. None of them had the risk factors. That's why it's so important. And most dentists will include this annually in the exam when you go in to have your teeth cleaned. So if not, you need to ask for it, because detecting it visually with the naked eye is very difficult.
Okay, do you need this type of velscope, or could it be any of that blue light that can detect it?
I think there are some other devices that are in the market, but for my opinion, I think the velscope is the most effective.
Okay. And you were talking earlier about the vaccine, the HPV vaccine, if families were interested in learning more about that, because that can help prevent some of these cancers.
Absolutely. So the HPV vaccine is going to help prevent transmitting the HPV to your partner, because as we know, it's transmitted through oral sex. And that's why it's so important to get the word out for these young kids. It's very important, because all of this is totally preventable.
Yeah, and the sooner you get it checked out, the better the chances.
Oh, 100%. It's a 90% survival rate. But the problem is the late detection
Yeah.
increases the mortality, and that's where we have the concern. And this is April Oral Cancer Awareness Month, so as dentists, we don't just drill and fill, we also are proactive in helping patients save lives.
And I kind of want to just tap into that before we go. Doctor, has it changed over the last 20 years? Like you just said, you drill and fill, but now you're noticing things and you're referring patients to doctors, and it's more of like a full body checkup.
Absolutely. We are actually your first line of defense. It's really incredible. We can diagnose sleep apnea. You know, as I said, patients that come in and they have super heavy bleeding gums and they might have bone loss, a lot of times they're diabetic. There are so many diseases that we are experienced and seeing the symptoms that we are aware, and we can refer them to their specialists. The biggest thing is high blood pressure. I can tell you patients get upset at us. We take high blood pressure every time they come, blood pressure readings every time they come in. And a lot of times they'll say it's, well, white coat syndrome. But not always is it white coat syndrome. And so I tell them a good thing they can do at home is if they have one of the blood pressure devices, they can check their blood pressure about 3 times a day at different times for 5 days. Write it down, and I tell them to call me and let me know the readings, because the problem with blood pressure, for high blood pressure, the damage to the heart is when you have fluctuations in the blood pressure. So it's real important that they get to see a cardiologist and get it checked, and I cannot tell you, it's probably 80% of my patients come back and thank me. They hate me at first, and then they thank me, and they think, thank you so much, because we have it you know, balanced and checked. So we as dentists, you know, see your dentist twice a year. We don't just clean teeth. We really can diagnose things, because you see us more than you see your practitioner, your health practitioner.
Absolutely. Texas Tooth Lady, Dr. Alani, thank you so much for joining us this morning.
Thank you.
Very important
Thank
information.
You. Thank you.